I presented here the data on Philadelphia-like ALL is an entity of B ALL that have a specific gene signature that is similar to the Philadelphia chromosome positive ALL, but it's different because it does not have Philadelphia chromosome. Genomically, it's very complex, so it has many different genomic lesions that are generally lead to the activation of different kinases signaling. There are several classes of pH-like ALL. The most common have either ABL-like signatures or CRLF2 overexpression as a result of the rearrangement, and also activation of JAK2 signaling is very common in several subsets of pH-like ALL. These patients usually present with a difficult to treat disease because they do not respond well to the conventional chemotherapy. They have positive minimal residual disease, and the overall survival is poor unless you introduce some other therapies or proceed towards allogeneic stem cell transplantation. The diagnostics is quite complicated, and it requires specialized flow cytometry testing, FISH testing, and also some genomic testing that is looking specifically at the fusions or rearrangements, which are only done in several specialized laboratories. As far as therapies, we know that conventional chemotherapy does not work well. There have been several trials adding the tyrosine kinase inhibitors such as ponatinib and dasatinib to the ABL class pH-like ALL, and they seem to indicate that these agents are beneficial. For the other subsets of pH-like ALL, ruxolitinib, the JAK2 inhibitor, has been tried. However, the data do not support that it is highly efficacious. So right now, the most effective therapies are introduction of immune therapies in addition to the chemotherapy, such as inotuzumab and blinatumomab in the frontline setting. Also, consideration of using the CAR T therapies and proceeding towards allogeneic stem cell transplantation. This is the only way to cure these patients, but I think we do need novel therapies, and I presented one development that we are trying to pursue, which is novel bispecific antibody that is targeting CRLF2, is early in preclinical development. So this is a brief summary of my talk, and I would like to mention that I'm very happy to be back at SOHO Italy because we collaborate closely with our Italian colleagues between MD Anderson and Italy colleagues in acute myeloid leukemia, acute lymphoblastic leukemia, and different hematologic malignancies. I think this kind of international collaboration is essential for especially rare diseases, difficult to treat diseases such as leukemias and other hematologic malignancies. And I think this is the way education and sharing our experience that we can move the field forward. Thank you.